If you suffer from high blood pressure, it is important to learn other non-drug treatment options of how to lower blood pressure. And in today's video, we are talking about high potassium foods that will help to lower your blood pressure naturally. About 47% of Americans have high blood pressure, yet 29% of those with the condition don't have it under control. This is largely due to our diet. The average American diet has way too much sodium and not enough potassium. This lack of control can lead to increased risks of severe health complications, including heart attack, stroke, and kidney disease. Why potassium, you ask? It plays several critical roles in the body that contribute to lowering blood pressure. These roles involve its effects on vascular, smooth muscle function, kidney function, hormonal balance, and overall cellular processes. Potassium helps relax the smooth muscles in the blood vessel walls, leading to vasodilation, widening of blood vessels. This reduces the resistance the heart has to pump against, thereby lowering blood pressure. It also improves endothelial function, the function of the inner lining of blood vessels, which is essential for maintaining vascular health and preventing hypertension. Additionally, potassium promotes the excretion of sodium through urine. High potassium intake signals the kidneys to excrete more sodium, which decreases the volume of extracellular fluid and reduces blood pressure. Proper potassium levels are vital for the normal functioning of cardiac muscles. This is because it helps regulate heart rate and prevents arrhythmias, irregular heartbeats, that can be associated with hypertension. The daily recommended allowance for potassium is generally around 4,700 milligrams for adults, with slightly higher needs for breastfeeding women at 5,100 milligrams. Avocado. Avocados are an excellent source of potassium, providing approximately 700 milligrams per medium fruit. This potassium content supports various health benefits, including blood pressure regulation, heart health, muscle function, nerve function, and bone health. Incorporating avocados into your diet can help you meet your potassium needs and contribute to overall well-being. Their versatility makes them easy to include in a wide range of dishes like salads, smoothies, guacamole, sandwiches and wraps, and toasts, making them a delicious and nutritious addition to your diet. 2 potato, a medium-sized baked potato, about 173 grams, contains approximately 926 milligrams of potassium, making it one of the richest dietary sources of this essential mineral. A single medium potato can contribute approximately 31 to 37% of this requirement. To maximize the health benefits of potatoes, consider the following cooking and preparation tips. 1. Baking. Baking potatoes with their skins on helps retain most of their nutrients, including potassium and fiber. 2. Boiling. Boiling potatoes can cause some loss of potassium, but the water can be used in soups or stews to retain the nutrients. 3. Steaming. Steaming potatoes is a good method to preserve their nutrients, including potassium. 4. Avoiding unhealthy additions. Be mindful of adding excessive butter, cream, or high-sodium toppings, as these can negate some of the health benefits. 3. Fish. Fish is an excellent source of potassium, with varieties like salmon, tuna, cod, mackerel, and sardines providing substantial amounts of this essential mineral. Fish are also rich in omega-3 fatty acids, which are beneficial for heart health, reducing inflammation, and supporting brain function. It also provides high-quality protein and essential vitamins like B12 and D. Here are some tips for including high-potassium fish in your diet. Grill fish like salmon, tuna, or mackerel with a little olive oil and your favorite herbs and spices. Bake cod, halibut, or trout with vegetables for a nutritious meal. Add canned sardines or tuna to salads for an extra boost of protein and potassium. Incorporate fish into stews and soups for a hearty and nutritious dish. 4. Beans. Beans are an excellent source of potassium, with varieties like white beans, lima beans, kidney beans, black beans, pinto beans, soybeans, and lentils, providing substantial amounts of this essential mineral. Many beans, especially colored varieties like black beans and kidney beans, contain antioxidants that protect cells from damage and reduce inflammation. Beans are versatile and can be incorporated into various dishes. Here are some ways to include them in your diet. Soups and stews. Incorporate beans into soups and stews for a hearty and nutritious meal. Burritos and tacos. Use beans as a filling for burritos and tacos. Dips and spreads. Prepare hummus or bean dips using chickpeas or white beans. 5. Unsalted nuts. Unsalted nuts are a nutritious and convenient source of potassium, which plays a vital role in maintaining heart health and lowering blood pressure. Examples of high potassium nuts varieties. Almonds contain about 200 milligrams of potassium per 1 ounce, 28 grams serving. They are also rich in magnesium, vitamin E, and healthy fats, which support heart health and reduce inflammation. Pistachios. They have approximately 290 milligrams of potassium per 1 ounce, 28 grams serving. Pistachios provide a good amount of fiber, protein, and healthy fats, contributing to satiety and cardiovascular health. Cashews contain around 187 milligrams of potassium per 1 ounce, 28 grams serving. Cashews are also rich in magnesium, iron, and vitamin K, supporting muscle function and bone health. Walnuts have approximately 125 milligrams of potassium per 1 ounce, 28 grams serving. Walnuts are high in omega-3 fatty acids, which help reduce inflammation and support heart health. Hazelnuts contain about 193 milligrams of potassium per 1 ounce, 28 grams serving. Hazelnuts are a good source of healthy fats, fiber, and vitamin E, which support overall cardiovascular health. Pecans contain about 116 milligrams of potassium per 1 ounce, 28 grams serving. Pecans are also high in fiber, healthy fats, and antioxidants, which help lower cholesterol levels and support heart health. 6. Leafy greens. Leafy greens are an excellent source of potassium, with varieties like spinach, Swiss chard, kale, beet greens, collard greens, and romaine lettuce providing substantial amounts of this essential mineral. Leafy greens are versatile and can be included in a variety of dishes. Here are some ways to add them to your diet. Salads. Use a mix of leafy greens as a base for salads, adding other vegetables, nuts, seeds, and lean proteins. Smoothies. Blend leafy greens like spinach or kale into smoothies for a nutrient boost. Stir fries. Incorporate leafy greens into stir fries along with other vegetables and proteins. 8. Fruits like banana, cantaloupe, apricots, oranges. Each of these fruits provides a substantial amount of potassium along with other essential nutrients that contribute to overall health and well-being. Here's a summary of their key attributes. Bananas. High in potassium, vitamin C, and dietary fiber, beneficial for blood pressure regulation, heart health, and digestive health. Oranges. Rich in potassium, vitamin C, and antioxidants, supports blood pressure regulation, immune function, skin health, and heart health. Apricots, high in potassium, vitamin A, and fiber, supports blood pressure regulation, eye health, digestive health, and skin health. Cantaloupe, high in potassium, vitamin C, and beta-carotene, beneficial for blood pressure regulation, hydration, immune support, and eye health. While potassium is an essential nutrient crucial for maintaining various bodily functions, certain categories of people need to be cautious about consuming a high potassium diet. These individuals may have conditions that affect potassium metabolism or may be taking medications that influence potassium levels in the body. These include people with kidney disease, risk of impaired potassium excretion. People with Addison's disease, reduced aldosterone production, affects potassium balance. People taking potassium-sparing diuretics, medication retains potassium. People taking ACE inhibitors or ARBs, medications affect potassium excretion. People with hyperkalemia, pre-existing high potassium levels. People with certain hormonal disorders, hormonal imbalances affecting potassium. People with type 1 diabetes, risk of hyperkalemia in poorly controlled diabetes. These individuals should consult healthcare providers to manage their potassium intake and monitor their potassium levels regularly to prevent complications.